Okay, hi everyone. Good afternoon from here. My name is Broba, and I'll be presenting to you today about the effectiveness of interventions, leveraging influences to promote vaccine uptake in the workplace setting. And I'm presenting to you on the traditional territories of the Blackfoot Confederacy, the Siksika, the Kenai, Piikani, and Tsuut'ina, the Stoney Nakoda Nations, the Métis Nation Region 3, and all people who make their homes in the Treaty 7 region of Southern Alberta. So going on, just a brief about my practicum placement. I had the privilege of completing my practicum with the CPSI team in Alberta Health Services, so the Cancer Prevention and Screening Innovation. And so for this team, their aim is to translate new knowledge into innovative and scalable cancer prevention and screening interventions to reduce modifiable cancer risk factors in defined population. So my role was to complete a rapid review as well as an environmental scan to better understand how influencers can be engaged to shift the conversation and support increased uptake of HPV immunizations amongst the 18 to 26-year-olds within the workplace setting. And this role is this work is part of a broader project that aims to leverage the impact of social influencers to shift conversations about HPV immunizations to meet the needs of different populations across a variety of settings with the aim of increasing uptake of HPV vaccine amongst this population in Alberta. For this particular presentation, I'll be focusing on just the rapid review and the findings from the rapid review. So going on, a brief about the problem, like the public health issue. So the human papillomavirus is the most prevalent sexually transmitted infections in Canada, and it is a known cause of numerous serious health issues and can also lead to cancers, including anal cancers, oral and cervical cancer, as well as vaginal and penile cancers. However, these infections can be prevented and they're preventable through the HPV immunization. And the HPV immunization is recommended for use in children and adolescents 12 to 17, and also through young adults 18 to 26 years old. In Alberta, they do have the publicly funded school-based immunization programs that they have in schools, starting from grade 6, and then as well as grade 7 for those that missed it in grade 6. It's been free for a couple of years, like since 2007 that the vaccine became available. However, for the 18 to 26-year-old, they only just got coverage for this group. And of course, with the onset of COVID-19, this news has not really spread across this population and that has actually also impacted knowledge. Not just impacted uptake, but despite the availability of the HPV vaccine and efforts to promote uptake, HPV immunization rates actually remain low, below the Alberta target of 90%. And as such, 7 out of 10 sexually active Albertans will contract an HPV infection at some point in their life, if not fully immunized. So considering the prevalence of HPV-related infections in the face of a publicly available vaccine, it's critical to identify and develop strategies and interventions to promote the uptake of this vaccine amongst these populations. So this rapid review actually aims to explore available literatures on the impact of leveraging influencers to shift the conversation about HPV vaccine and norms in the workplace with the aim of promoting the vaccine uptake in the workplace. And so as a first step, these research questions were developed with a research librarian. And the first question was, which interventions and approaches have been implemented and shown to be effective in promoting HPV vaccine uptake in the workplace setting? And as well, what is the effect of leveraging influencers in the workplace on vaccine uptake. So leveraging the workplace as a setting presents a unique opportunity to reach a large group of people within the adult population, and it does provide access to individuals that are difficult to engage through the traditional means. And so going on, the method that I actually used, a search strategy was carried out across 7 databases. And then before that, a preliminary search of gray literatures indicated an unavailability of literatures, leveraging social influences to promote the uptake of HPV vaccine in the workplace. So other vaccine interventions, such as influenza and COVID-19, were considered and included in the literature search. So I've searched through 7 databases and came up with about 900 papers, utilizing the inclusion and exclusion criteria, and only 8 relevant studies were actually included in this review. So that's also to say that the amount of public literature, like academic literature, explicitly exploring the use of influencers in the workplace setting to promote HPV vaccine uptake, it's really scant in this area. Okay, so going on to my findings. Actually used the social ecological model approach to analyze the findings, including identifying influences at different levels and their influences on vaccine uptake. The social ecological model suggests that multiple levels of influence interact to determine participation patterns in worksite health promotion programs. So influences were identified across all levels of the social ecological model. At least 3 levels of the socio-ecological model was more prominent in the literature. So for example, at the policy level, the influences that we, policy makers can be identified as influencers. So those policy makers that come up with policies, so for example, the pre-vaccine coverage was actually identified to be to promote uptake. So they echoed that in this particular study, they echoed that they actually got vaccinated because it was free, because the vaccine was offered for free. As well, if we go on to the organizational level, it was determined that organizations with positive health norms and those that actually supported vaccination clinics in the office, and they also supported these interventions in the office, actually had it was actually effective in promoting the uptake of the vaccine. So organizations as well can be influencers, so to say, at this level. So going on to the interpersonal level, that's where we have family and friends and social networks. So it was identified that peer-to-peer influence was also a good determinant for uptake. So they had like peers that they used as social influencers. So people that they have like key peers in the organization. So maybe leads, employees, fellow employees, and those ones were trained, and then they were actually talking about this vaccine and how good it was to take the vaccine and why they took the vaccine. So all these kind of helped the other people. So it was found that in a particular group, people were more likely to take this vaccine because their peers had already taken the vaccine. So that sort of peer influence or social network was actually seen to be helpful in promoting the uptake of this vaccine. And as well, a particular study did expand the on-site vaccination clinic to include family and friends of employees. So they were able to come to the organizations to get this vaccine. And so that actually also promoted the uptake of this vaccine, so that was an effective measures. Going on, Going on to the implications now and the way forward. So this review was meant to actually provide recommendations for designing and developing a workplace HPV vaccine clinic. Now, given that social network has an influence on vaccine uptake among employees, there's a need to consider peers and leaders, as well as managers in the workplace, and leverage them as social influencers, like for promoting the uptake of the vaccine. There's also the need to consider campaigns that are tailored to the organization's specific context and populations. As well, we did find out that interventions involving a multi-pronged approach were more effective compared to single approaches. So combined interventions have shown to promote vaccine uptake.
Well, Broba, if you can hear me, you're breaking up. We're also at time for your presentation. So I'll ask you to quickly summarize your final points.
Socio-ecological levels. Intervening across at least 3 socio-ecological levels was effective in promoting vaccine uptake in the workplace. A major limitation is the depth of literature on this topic, but as well, this also presents an opportunity for future research in this particular area. And it may be worthwhile to also adapt campaigns from a wider variation of health promotion context, including sexual health, because most of the literatures that were included here was just limited to influenza alone.
Thank you, Broba. We're at time, so I will let your slide do your talking for you in terms of your thank you, so that we have some time for questions.